The orientation program for newly licensed patent medicine vendors in Osun State, organized by the Pharmacy Council of Nigeria (PCN) in collaboration with the Patent and Proprietary Medicine Vendors License Committee, provided a platform for the regulatory bodies to sensitize the newly licensed members on the rules and regulations guiding the practice of their profession. While declaring the orientation program open, the Osun State Commissioner for Health, Mr. Jola Akintola, who was represented by the Permanent Secretary, Ministry of Health, Dr. Isiaka Adekunle, implored the new vendors to contribute their quota to the healthcare services in Osun State by abiding by the rules of engagement as public health defenders. He maintained that government will continue to monitor their activities to ensure that no one runs foul of the law.
Many people applied for this license, but very few of them have the privilege of being granted. And these ones that are given this license should just make proper use of it. They should not handle the drug they are not supposed to handle. They should not treat in the kind of drug that they are not supposed to treat in. And they should not do a bad habit that will make them to run foul of the law of the state.
In his address, the Registrar, Pharmacy Council of Nigeria, Mr. Ibrahim Babashehu, who was represented by Mr. Kayode Atere, stated that the Pharmacy Council of Nigeria is an agency of the federal government committed to ensuring the provision of sustainable pharmaceutical regulatory services for the well-being of the populace. According to him, the PCN recognizes patent and proprietary medicine vendors are important stakeholders in the healthcare delivery system at the primary level because both public and private health facilities are inadequate to meet the needs of Nigerians. He maintained that the license holders are expected to attend continuing education program at least once in every 2 years.
The Pharmacy Council is a federal government agency and we are charged with the responsibility of ensuring quality pharmaceutical services through the instrumentality of capacity building. And so this orientation program is one of the ways to enhance the practice of the patent medicine vendors. So whoever is given license by the federal government should be somebody that is qualified to handle simple household remedies, not to endanger the lives of the public.
Also speaking, the Director of Pharmaceutical Services, Ministry of Health, Mr. Razak Saliu, appealed to the vendors to practice ethically and within the scope of their license to avoid losing their license.
They have been screened and the selection process has been done when they did an interview and exam and before the selection was done. So they are here now to know the scope of the activities, what they can do, and by inference what they cannot do, and the penalties involved if they are found wanting doing what they are not supposed to do. We had a series of lectures, about 9 lectures, giving an overview of the patent medicine story since 18th, 17th century up to date in Nigeria.
Some of the newly licensed patent medicine vendors who spoke with OSBC News appreciated the efforts of all the stakeholders in equipping them with the necessary information needed to excel in their fields of endeavor. Oluchi Amuda, OSBC News.